So I'll be discussing a inhaler recycling scheme that is due to start in the Upper Valleys cluster, which is being led by Nikki Watts, who is the lead pharmacist for the cluster, supported by myself, Rhian Newton, who's head of prescribing and meds management, and Amy David, primary care pharmacist. The project will be the first of its kind in Wales, so we're really pleased to be able to lead on this. Just to give a bit of background information, as you're probably aware by now, metered dose inhalers contribute to approximately 3.5 to 4% of the carbon footprint of the NHS. If sent to landfill, the main propellant that is used, HFA, can leak out of the inhalers, which is harmful and contributes to global warming. As a health board, we have an objective to recycle at least 80% of inhalers prescribed by 2025, which is aligned to our decarbonisation action plan. And Nikki Watts, the lead pharmacist, has been fundamental in driving sustainable inhaler disposal within his cluster. From some background surveys that have been undertaken, Nikki, Amy and colleagues within the Upper Valleys cluster found that 90% of users within the cluster dispose of the inhalers in general waste, which is a huge amount, especially if the figure is consistent across the health board in terms of other clusters and also hospital sites within the health board, but also across Wales. So the Upper Valleys cluster started an inhaler returns campaign where patients were encouraged to return their inhalers to the local pharmacy for responsible disposal. As part of this, Nikki and his team collated some initial patient surveys, and from 40 respondents, you can see that 47.5% disposed of in general waste, 40% dispose of the plastic parts in household recycling and other parts in general waste, but worryingly 67.5% were not aware of the environmental impact of the responsible disposal. What's encouraging that is, as prior to the returns campaign, only 10% returned to their local pharmacy. However, after the survey was completed, 97.5% of respondents were willing to return the inhalers. Nikki and his team have been educating patients to dispose of inhalers responsibly. Pharmacy staff then add a sticker to the inhaler packaging, acting as a prompt, and advise patients to return the inhalers to the community pharmacy. As you can see from the data collected, the number of inhalers that have been returned to the pharmacy by patients to date, there's an encouraging increase in returns from October 21 to May 22, albeit there are some dips. Sorry, I've gone. There you go. During this period, a total of 144 dry powder inhalers were returned and 491 metered dose inhalers. As you can see, a larger proportion of metered dose inhalers have been returned, which could indicate we're prescribing too many inhalers of this type, especially if inhalers with lower global warming potential would be suitable. We have ongoing work to tackle this across pharmacy. So I think communication and engagement with both staff members and patients are going to be key. Working with both Nikki and Amy, we're looking to increase patient and staff education on responsible inhaler disposal and promoting the inhaler recycling. We will be developing patient-facing videos and other communications that will be shown in waiting rooms and within community pharmacies themselves, and also our social media coverage regarding the scheme. All of these, as well as word of mouth, will raise awareness, and hopefully we'll see a change in behaviours. And also, as part of our pharmacy decarbonisation board, there are other staff members that are involved across all hospital sites and within community pharmacy and primary care, looking to increase patient and staff education as well. So currently, with the inhaler returns campaign, inhalers are incinerated, which is better for the environment than going to landfill. As a result of this, Nikki identified the need for an inhaler recycling scheme. We submitted an application as part of Health and Social Care Climate Emergency Funding Scheme to apply for funding for the project, which we are pleased to say that we've secured. We've also identified that Grundon Waste Management are able to recycle the inhalers, and it is planned that Grundon will collect from one central point within the Upper Valleys cluster. One bin will be collected every 6 months, which can hold approximately 1,500 to 2,000 inhalers. They are then taken back to the plant in Gloucestershire for processing. We're also working with RAP Cymru, which I think Natalie mentioned earlier, who are a Welsh government-funded not-for-profit group, who also ensure that resources are kept in use for as long as possible. We're going to look at recycling potentially other products, and if any parts of the plastic from the inhaler can be used in collaboration with local companies to produce new products. We have currently identified a company based in Gower that are able to recycle the mouthpieces from the inhaler, and we're currently in initial discussions with them. And also, being the first scheme in Wales with the inhaler recycling, we are absolutely happy to support other health boards and community pharmacies in implementing this if support is required. One thing that I think has been mentioned quite a lot today is sustainable materials management. I think it's important to note that even though Grundon are recycling the materials, as a health board, we need to know exactly where the materials are going, as it would be slightly counterproductive if they were being flown abroad to get recycled. Grundon are based in Gloucestershire, which isn't local to Swansea Bay. However, they're the closest organisation that we identified that was suitable for facilitating the recycling. But by ensuring sustainable materials management, the HFA gets reused in refrigeration. The aluminium is supplied to a local metal processing facility to be recycled, and the plastic casing is absorbed in other plastics within Grundon, then supplied to approved partners within the plastic recycling industry. This might change slightly if we work with RAP Cymru and Grundon together, as I did mention that some parts might be able to be used with a local company to produce plastic products. And finally, just to conclude, we have a number of other projects that are ongoing within pharmacy at Swansea Bay Health Board. These include promoting an increase in prescribing low global warming potential inhalers, the appropriate disposal of unused and unwanted meter-dose inhalers in secondary care, respiratory reviews in primary care, Ventolin Salamon inhaler switches, as Salamon inhalers have less of a detrimental impact to the environment, green awards within our acute sites, and delivering educational sessions in care homes on appropriate inhaler use and disposal. So thank you. I've included my email here, but if you do have any questions, if you've got time, I'll answer them. If not, I'll have a look at the chat as well.